Hi guys, welcome back to Identification and Care of Surgical Instrumentation. As you guys know, I canceled this previous Sunday's class in the morning due to a family emergency, and I told you guys that I would do a video lecture as a recompense. So here it is. So we'll cover suction tools, retractors, general use instruments, and vascular and thoracic tools for this lecture. So we'll look at suction instruments, their function and care, retractors, types and inspection, general and vascular tool handling, looking for signs of wear and tear on instruments, and their removal protocols, how instrument design affects cleaning. So suction instruments are all about visibility. Without them, the surgical field can quickly become obscured by blood or other fluids. You'll see common types like Yonker, which are rigid and general purpose, Pool, which are better for large volumes, thus they're often used in abdominal surgeries, and Fraser, which are more delicate and used in ENT or neurosurgeries. Most suction devices come with a stylet, not for cleaning though, but to remove surgical blockages on the fly during surgery. For reprocessing, always remember these must be flushed and brushed thoroughly to prevent biofilm buildup. And just for clarification, they are used for ENT also, which stands for ears, nose, and throat. And a stylet is a thin wire or rod inserted to clear clogs during surgery, and like I said, it's not used for cleaning. As an extra note, always follow instructions for use carefully. Some suctions are delicate and may clog or crack during rough cleaning. So when cleaning suctions, you always want to use a brush that fits just right, not too big and not too small, and it should be long enough to go all the way through to the tip. Think of it like a pipe cleaner. If it doesn't go through end to end, it's not doing its job. Always check the distal tip, and the distal tip is, sorry, it would be this end. All right. And the very end that enters the surgical field for any signs of wear, dents, or sharp edges. Never use a stylet for cleaning. It's not meant for that and can damage the lumen as a result. Your go-to rule here is follow the IFUs of any instruments. Each brand and type might have slightly different steps. So not all suction tubes are created equal. You can already see here, some are straight like a pool suction, some have curvatures and angles to them, and some have removable parts, such as the Yonker suction. So you'll need brushes specially tailored to them. Using the wrong brush size can either miss debris or even get stuck and cause cracks and dents inside the actual lumen, which, as you guys know, is going to be prone to more bioburden as a result. Always check the suction tip before reuse. Even a small crack or a sharp edge can end up harming the patient, by traumatizing their tissue or causing infection. If it's blocked and a stylet can't clear it, some techs use orthopedic wire as a result, but that's risky and should only be used as a last resort. So which part of the suction instrument must always be checked for sharpness and damage before reuse? A, the suction handle, B, the suction tubing, C, the suction tip, D, the connector port. So for this one, it's the suction tip. So if there are any dents at all in this, it could cause harm to the patient's tissues and other vessels. And so what should we use to clean the small suction tubes, such as those used for ENT procedures? So the design affects performance and cleaning needs. Check the tip for damage before reuse. Use properly sized brushes for small tubes. Some ENT suction brushes are manufacturer specific, so they'll actually provide us with brushes. And in some cases, when we run out or when we're out of stock for those specific brushes, we could actually use orthopedic wires, um, but you have to be extremely careful with them. While they are quite flexible to push through the lumens, at some points, if there's a blockage inside the lumen that's very stubborn, like a dried up blood or any other kind of bioburden, when you push into it, you could push towards the lumen itself and damage it. So you have to be careful with that. And just for your reference, French sizes means the diameter of tubing, right? So the diameter of the tubing itself. So a higher French means a larger tube. Typically for ENT procedures, they use very tiny, small French suction tubes. So why do some suction tubes have two channels? Some suction instruments um, are designed with these two channels, usually one for suction and the other is used as a vent or guide for the stylet. As you can see here, this is a stylet. This design helps prevent blockages and allows the surgeon to control suction pressure better. But it also makes reprocessing harder as a result. These dual channels must both be flushed and brushed thoroughly. If you miss cleaning one side, biofilm can build up quickly. So you always have to refer to the IFUs as mentioned, especially for ENT or neurosurgical suctions where the tubing is tiny and fragile. And so now we're looking at instrument integrity. So what you should check before reusing. Before reprocessing or reusing any suction tool, you need to check its integrity, meaning is it physically safe and functional? Focus on the tip or distal end, which goes directly into the patient. Look for sharp spots, dents, or corrosion. Even a tiny flaw can lead to tissue damage or contamination. Don't forget to check connectors and handles. Make sure nothing is loose or cracked. Always refer to your department's inspection checklist, and if something doesn't look right, tag it and pull it out of circulation. Note, tagging damaged tools is part of the MDRD workflow. You have to document, isolate, and notify supervisor or whoever else that's responsible, such as the coordinator or the supervisor assistant. So if you look here, I think it says lumen patency. So that refers to the openness and unobstructed state of the internal channel or lumen of any medical device, such as a suction instrument, needle, catheter, or endoscope. And now we're looking at the surgical suction and how it works. So it removes blood, fluids, and debris during surgery. Like we said, a larger French size is more power, and although it's less precision as a result, a smaller French size is more precision, but it does clog easier. Tip size affects suction control and safety. So you have to choose tip based on procedure type. So if you're working on more delicate procedures, more delicate organs such as those inside the cranial cavity, your brain, your eyes, um, typically the French sizes of the suctions are smaller. And if you're working on larger cavities such as your abdominal cavity, your pelvic cavity, then the sizes of the suctions are much larger as a result. And we're looking at the suction tips. So surgical suction tools aren't one size fit all kind of instrument. The French size tells us the diameter. Smaller tips are much likely to clog, as I mentioned. That's why it's important to choose the right tip for the procedure and to clean it thoroughly. Remember, more suction isn't always better. It also depends on the surgery. And if you were to look at the conversion examples here, this is why we don't use millimeters or even inches to talk about the diameters of suction tips. It's just too difficult to remember. So that's why we just say 3 French for a 1 millimeter suction tip, 5 French for 1.67, 7 French for 2.33 millimeters, and so on. And I would say the most common French sizes are 3, 7, and 12. Those are the ones I see often, even a 9, but it's not listed here. Now we're looking at retractors. So retractors literally make space during surgery. Some are simple handheld tools like a sand retractor, as shown here, sorry. While others are more complex and self-retaining, such as the Gelpi retractor. Either way, they need to be inspected very carefully. Check for bent or broken prongs. So if one of the prongs here is missing, you have to immediately put this for repair. You also have to check for cracked welds and damaged springs. So for this one here. A key thing to look for is metal flaking, especially with much older retractors. Even a small bit of flaking finish can contaminate the surgical field. Use the paper test to check for that, and we'll talk about that paper test more in a bit. So paper test, basically, in short, you rub over white paper to detect loose metal flakes. So types of surgical retractors. We've talked about hand retractors and self-retaining retractors in detail. So retractors come in dozens of designs, and the type used depends on what's being exposed. So skin, soft tissue, or organs. Some retractors are narrow and shallow for hand surgeries. Others are long and curved for deep abdominal access, like these ones here. Or staff will often request retractors by blade width or shape. That's why you need to be familiar with the basic designs and how they're measured. And so a table-mounted retractor is also a self-retaining retractor for the most part. So an important thing to remember is that all table-mounted retractors are self-retaining, but not all self-retaining retractors are actually table-mounted. As for example, the Gelpi retractor, the Beckman retractor, all those other self-retaining retractors, they're not actual table-mounted. They have to be set up by the surgeon or assistant themselves. Right, so these are some example retractors that I decided to place here. So self-retaining retractors, such as the Beckman here, have a ratchet mechanism. So there's a lever here. So you would push that lever down to test the ratchet during inspection. If the lever springs back, it's working properly. If it doesn't, you have to remove it from service. And then we have an Omni retractor here, which is a known table-mounted retractor. So this one is also self-retaining. So that means all that the surgeon and assistant need to do is to just set it up in the field, and they don't have to do anything manual for it unless they're readjusting it. And then vein retractors, this one is manual, meaning the surgeon or the assistant will have to hold it during a surgery to keep it in place. And these are some retractors in use. So this one is a Bookwalter retractor. And the Bookwalter comes with several blades, for the surgeon's convenience. So they get to decide which one they need to use, if they need a larger blade, for example, or a skinnier blade. And these ones are manual ones, manual handheld ones. So this one here is called an Army Navy retractor. And as you can see, the assistant has to hold it in place. And here is Gelpi retractors. This one is actually being used on a dog in a vet procedure. As you can see, they are using multiple to keep it in place, which is very inconvenient, but there's really nothing that can be done. The table mounted retractor would be too big in this case, so that's another useful factor and benefit to using these kind of self-retaining retractors. They're much more flexible in this manner. So how is this ratchet tested on a self-retaining retractor? And I already mentioned it, but when placing retractors, especially these types, the self-retaining types, the ratchet is what keeps the blade open and in place. So this is the ratchet. To check if the ratchet is working, you have to push the lever down. If it springs back, this internal spring and function are working. If it just stays down and doesn't spring back, or it feels too loose, it's not safe to use and needs to be pulled from circulation and sent out for repair. So this is a quick test, but it's a very critical one. It prevents instruments from failing mid-procedure, which can be dangerous and to the patient and delayed surgeries as a result. So how are hand retractors measured? So handheld retractors are measured in 3 parts. So the overall length, as you can see here, which goes from the bottom of the handle to the tip of the blade, and the blade width, and the blade depth. So it would be from this end to the tip of the handle. Sorry, not the handle, the blade. For example, you might hear 10 and 1/4 inches long with a 2-inch by 2.5-inch blade. Knowing how to read these measurements helps you pull the correct item when prepping trays or assisting OR teams. It's also useful during inspection. You need to examine the full length of the blade, especially the tips, for any bending or wear. So typically when OR personnel, like the scrub nurse, calls, they're asking for a 2-inch wide or Richardson retractor, for example. They typically request referring to the width of the retractor itself. So they rarely ask for depth or overall length. They don't really care about that. What they care about is the width itself. So if they're asking you for a 2-inch Richardson retractor or Kelly retractor, they typically mean the width of the actual blade itself. So cleaning and inspection of retractors. Inspection is critical for retractors. Like I said before, you have to use the white paper test. You can also use a white lint-free cloth or white towel. So what you do is you rub the instrument over a clean white sheet, paper, towel, whatever, while wearing gloves. If you see black or gray specks on the white sheet, that's metal flaking off the finish, the passivation finish, which is a contamination risk. Next, you have to check any springs or levers on the self-retaining retractors or any retractors with locking mechanisms. You have to ask if they're moving smoothly or are they stuck. You also have to check the tips of blades for bendings or cracks. You have to look at welds and screws for fractures. If anything feels off or looks damaged, it's safer to remove and report it than to take that chance on the patient. So if you see here stress fractures, that's basically just a small, hard to see crack that weakens the instrument. So what simple test helps identify metal flaking in retractors? Magnet test, we have a white paper test, leak test, weight comparison test. And we just talked about it, it's the white paper test. It doesn't necessarily have to be a paper, like I said. Anything white that could make it easier to see the flaking metal, it should be helpful. Um, we don't use the towel or cloth to wipe down retractors. Also, you should not do that as it can leave microfibers in the chipped surfaces of retractors, which as a result can contaminate the surgical field. So you don't actually use white cloths to wipe it down. You just place it below the instrument, and with your gloved hands, you just slowly feel the retractor to see if there's any flaking. If there's no flaking, if you've made sure there's none of that, you could use the cloth to wipe it down if it's wet, for example. So like I said, this is a more detailed step-by-step process of the flaking check for on the retractors. So I'll leave that to you guys to read if you want, but we've gone over it several times already. Now let's look at some examples or an example of a retractor. So the malleable retractor, also known as the ribbon retractor, is a bit unique in that it's not like any other retractor. They can actually be bendable. So typically they come straight to you like this. And when you receive it in the decontamination phase, they actually have to make sure, the OR personnel, that it's straightened for us. Otherwise, we're gonna have to do it ourselves, which is not our jobs. So they're super flexible, like I said. You can bend them into different shapes to fit the surgical site, which makes them useful for deep or oddly shaped areas, especially in the abdominal area too, where there's a lot of organs on top of each other, for example. They're common in there as a result, and even in the chest area. But because they're constantly bent, they can develop metal fatigue. So that's the weakening of metal from repeated stress. And as a result, small cracks or weakened spots can be hard to see because of this constant metal fatigue. So after every use, you have to carefully inspect the entire length of the blade. If it feels soft or has visible damage, you cannot risk it. You will have to replace it. In general instruments overview, they are your everyday tools in the OR. So things like towel clamps, scalpel handles, needle holders, because they're reused so often and in so many types of surgeries, they're more prone to wear. You should always check that clamps lock properly. Sorry. Knife handles are compatible with blade types, so there's no wear and tear, so that the blades can smoothly fit into these. And that there's no rust or misalignment at all, especially for handheld instruments like clamps. These tools may look simple, but if a clamp doesn't look right, like it doesn't close properly, it could compromise the entire procedure. So which of the instruments listed below is considered general instrument based on their function? So as you guys know, general instruments are used across a wide range of surgeries, while specialty instruments are limited to specific fields like ENT, eye, or orthopedic surgeries. The good thing about differentiating them is that usually specialty instruments will actually have their specialty in their name. So tenotomy scissors. Their function is for precise cutting of delicate tissue in eye surgery, and as a result, that would make them specialty instruments. So you would never use this in the abdominal cavity, for example. They're much too fragile, and they're not strong enough to cut fascia or stronger tissue, right? They're only used for delicate tissues. And we have Fraser suction tip, which is for fine sectioning in small surgical areas such as nasal cavities or even abdominal sections. It could be used there. So as a result, they'll be known as general surgery instruments because you could actually use them in any area. The only thing that matters is the French size of them. So if you're using them for a nasal surgery, obviously the French size would be smaller and thinner because these surgeries require more precision and are more delicate. And then we also have the Younger suction tip, which are used for general section of fluids in open surgeries. And these ones would be considered general too. They're not just used in thoracic surgeries, for example, or vascular surgeries. You could actually use them in abdominal, you could use them in gynecological, urology surgeries, and so on. And then we have the bone ronger, and clue is in the name, it has bone in it. It's used for biting or removal of small pieces of bone in orthopedic procedures. So as a result, they are specialty because they're used specifically for orthopedic procedures. And anything related to bone manipulation, bone cutting is automatically considered an orthopedic procedure. You could be more specific with it if it's, a spinal procedure. So and we have the Army Navy retractor, which I've shown actually in one of the pictures. It's the handheld retractor for shallow tissue retraction. As a result, it's used for general surgery because you don't just find shallow tissues in, let's say, the chest cavity. You don't just find it in abdominal cavity, right? You could find it in anywhere, any part of the body. You could find shallow tissue. And we have Adson tissue forceps, which is used for grasping tissue during suturing or dissection, and that's for general surgery as a result. Um, Tissue can be found in any part of the body, not just in the neuro surgical area, for example, or any of the ENT areas. It could be found anywhere. Kerrison ronger. It removes bone in spinal surgeries, especially around vertebrae. So as a result, it's a specialty instrument. We have the weight longer retractor, which is self-retaining for soft tissue exposure, and as a result, it's a general specialty, right? It's not used for any specific one. And then the ear speculum. Then again, it's very telling, based on the name, if it's specialty or general. Uh, so we have ear in it, so that's immediately an ENT instrument. And it allows for visualization of the ear canal. And like I said, makes it a specialty instrument. So that's what makes it very simple. When you see names of instruments in a test, if it says orthopedic ronger or um, ophthalmic tenotomy scissors, ear speculum, it's very telling what's specialty it's for. For example, a vaginal speculum, you would know that's for gynecology procedures, so that would make it a specialty procedure. You would never use that for anything else, right? So if there's a specific body part or a specialty mentioned in the name, chances are it's not a general instrument. I'm thinking on top of my head if there's anything that could help you guys more to remember the instruments and their specialties, but I think that's the best way to differentiate them. Yeah, so also rongers are typically used on bone, so that would be a specialty. That's another tell for it. All right, and then we're looking at vascular and thoracic instruments. So these are some of the most delicate tools you'll handle. They are very tiny for the most part, except for this instrument here, which is probably the size of your chest lengthwise. So these are used in high-risk surgeries like open heart or chest procedures. They include long, fine instruments like the DeBakey forceps, bulldog clamps as shown here, and sternum saws. Because of how small and precise they are, even a tiny bit of rust or misalignment makes them unusable and even dangerous to use on patients. These tools are also harder to clean due to their size, um, and oftentimes they come with small lumens or grooves that need manual brushing with specialized tools. You have to pay extra attention when reprocessing these. So like I said, cleaning precautions for vascular and thoracic instruments, you have to be very cautious when cleaning this. Um, if you think that the grooves on a regular DeBakey forceps were small, imagine them on the bulldog clamps. These are about 3 times smaller than a DeBakey forceps. Um, Most of the time, because you're working on the chest area, a lot of the tools are actually retracting tools and clapping tools as a result. So for these ones here, you have to make sure you see the grooves here, the serrations. You have to make sure there's no rusting. You have to make sure that the locking mechanism works. And honestly, for cleaning precautions for these instruments, you just have to be careful of the grooves. And you have to inspect them even more carefully because they're so tiny. And now we're going to be looking at some new instruments here. So the first one, we have the Baron suction, which is a fine, precise tool, a suction tool used in ENT and neurosurgical procedures. It's great for delicate areas, um, but its narrow lumen actually makes it very easy to clog. So it also comes in French sizes, so it's important to use the right brush size when cleaning it. Like we said before, too big, you'll damage it, too small, and the debris gets left behind inside the um, lumens. And it also has a thumb hole that lets the surgeon adjust suction on the fly, which is great in tight spaces for them. So you have to be gentle with these and always refer to the IFUs because they tend to be finer suction tips. They're actually much more delicate as a result. And then we have a Lenkenbach retractor. So it's simple but very useful. It's a handheld tool, so it's not self-retaining. It has to be held by the surgeon's assistant. And so it's a handheld tool with a flat handle and a right angle blade that kind of curves downward like this. So surgeons use it for shallow retraction. So think muscle layers, soft tissue, and any other orthopedic cases. Because it's a single blade design, it's easier to clean and inspect. Still, you'll want to check the blade tip for bending or rough edges, especially after repeated use. It's one of the most basic instruments you will work with, but that's what makes it show up in many trays, and that's why you have to carefully check them. Then we have deeper retractors, which is actually designed for deeper retraction. So it's the opposite of the Lengenbach retractor. So it's used for pulling aside abdominal walls or large organs, for example. So it's long and thin and curved. So some example specialties it's commonly used in are OBGYN and general surgeries. Because it's so powerful, it must be placed gently. Too much pressure can bruise or injure tissue. So it's actually a heavy retractor. That's why it's important to inspect these for smooth edges and any signs of warping. Cleaning can also be tricky along the curve, so brush end to end of the blade carefully. And then we have a Sen Miller retractor, and it's also a handheld retractor. You could also just call it a Sen retractor. That's the more popular name for it. We don't usually mention the Miller part of it in most GTA hospitals. So you'll find these in smaller surgeries like on the hands, feet, or even in plastic surgeries. So the rake part of this can be sharp or blunt. And usually when the OR personnel, when they call MDRD, they'll let us know if they want a sharp or blunt. So you will have to give them according to their request. Um, so it also depends on the surgery, of course. So you have to check for bends or broken prongs. So for sharp pronged Sand Miller retractors, you have to make sure that there's no missing sharp edges. Otherwise, you'll have to send them out for repair. So damage to the rake could cause real harm during surgery. So you have to double check these ones. And as you guys know, since these are pronged, especially the sharp ones, these would be considered the traumatic side of the Sand Miller retractor. And since this one is just a flat blade, this would be the atraumatic side of the Sand Miller retractor. We have ribbon retractors. We've already talked about it. So these are very versatile as a result because you could bend it to whatever, um, you could adjust it to any shape you want, um, depending on what surgery the surgeon is doing. So it could fit in any surgical site or space. It makes them ideal for deep or curved areas like the abdomen or chest. Uh, but like I mentioned before, that flexibility means they're at risk for metal fatigue. Repeated bending can cause the material to crack over time, so you need to check them closely after every use. You have to feel along the edges with gloves and surfaces for sharp points, warping, or any stress lines. And then we have a Richardson retractor. This one is probably the most popular handheld retractor in abdominal surgeries. Typically, you will find multiple sizes in them, and it's usually an extra large, large, and a medium size, the Richardson retractor. Because it's used under tension, you want to inspect the welds where the handle meets the blade and check the edges for sharpness or dents. Different sizes are used depending on the depth of the incision. So make sure you're grabbing the right one. And we have a Nathanson liver retractor. And it's also oftentimes just called a liver retractor. This one is actually table mounted. So it's a curved retractor that's mounted to an OR table. It's used mostly in laparoscopic surgeries to hold up the liver so the surgeon can access areas like the stomach, esophagus, or diaphragm. Because the liver is so delicate, this retractor needs to be padded or supported properly to prevent pressure injuries. Inspect for cracks or bends in the shaft and make sure uh, it mounts securely. So, like we said, because the liver is so delicate, you have to make sure um, this part here of the retractor is smooth. There's no burrs on it, there's no cracks. Otherwise, you could actually injure the liver and cause damage to it. And then we have a circumcision clamp here. So this is actually the circumcision clamp. Usually it arrives in the decontam fully assembled, and that is the major error on the user department's part. They have to disassemble it like so. And one of the biggest reasons why they actually don't disassemble it is that these two pieces tend to go missing. So they just send it as is. But the issue in that is that they don't properly clean it at all. Uh, Most often we will find foreskin residue on this part here, which is not what we want to see in MDRD. So this specialized instrument is used in male circumcision to both clamp and guide the cutting process. It's designed to prevent bleeding and minimize trauma. These tools must be checked carefully for alignment and smooth contact surfaces, otherwise you will be doing a lot of damage to the foreskin and penis. A misaligned clamp could cause uneven pressure and injury. Make sure you understand the model you're working with. Each one has a slightly different design and safety profile. And if you're curious about how it works exactly, this shows the step-by-step process of it. And it's not a pretty, it's not pretty. And then we're looking at bulldog clamps in more details. They're also called vascular clamps because they're most often used in vascular procedures. So they temporarily stop blood flow during surgery. They're spring loaded, as you can see here. So they automatically clamp down when released. You'll see them in a range of shapes. So they could be straight, curved, or even serrated. Because they're small and precise, you'll need to check that the spring closes fully and that the tips align perfectly. Don't let these bounce around in trays. They're very fragile. So usually they're actually placed in trays with silicone tray liners, just so you could push them in between the liner brush bristles. You have to make sure you clean these with small brushes and inspect under good lighting. And now we're looking at the rib retractor, which is also called a Finochetto retractor. It's a powerful tool used to spread the ribs during thoracic or open heart surgeries. It's crank operated, and that crank must move smoothly and securely. If it grinds or slips, that's a major issue. You also have to check the gears and joints for rust, flaking, or wear. This is one of the heaviest retractors you'll handle, so don't stack it with fragile tools in the tray. Um, in fact, it's so heavy that for the most part, they're actually placed in their own trays. So it should be cleaned carefully and lubricated if required. And that's all for week 8. It's a lot of instruments that you have to know, but what's important is knowing how to differentiate general instruments from other specialty instruments, really. That's all you need to know. So if you see an instrument commonly in a lot of specialties, that's automatically called a general instrument. So that's scissors, right? Scissors are not just built for abdominal surgeries, they're for all kinds of surgeries. So that's why scissors are considered um, general instruments. Anyways, if you guys have any questions, my email is here. Please let me know if um, how the assessment goes. I've actually decided to start giving assessments again. I think that will really help students out in the tests and quizzes and even especially the exam. So please let me know if you guys have any questions. And for the assessment itself, I've actually posted it already. So keep an eye out on that. Please do it yourself if possible. And by Friday, I will post the answers for them. Okay. So have a good week, and I'll see you on Sunday. Thank you. Bye bye.